Hi there, I am Dr. Udaykumar Jadhav, the Medical Director of Life Care Clinic. I have been working in HIV/AIDS from past 16 years. I worked with the national faculty as well as the international patrons in HIV/AIDS. I am working day and night for the welfare and treatment management of HIV/AIDS patients. Today we are going to discuss what is HIV. HIV is a virus which is transmitted by a sexual route and which affects the T cells. T cells are the major immune cells of our body which help us to fight common bacterial infection as well as viral and parasitic and fungal infections. When the T cells are decreased, then the body gets compromised, and that is what is called as HIV or human immunodeficiency virus. HIV is transmitted through majority by unprotected sex. HIV can also be transmitted to male semen fluid as well as vaginal secretions. HIV can also be transmitted by infected needles or dirty needles. Patients who used reused needles can also be affected by HIV. What are the signs and symptoms of HIV? HIV is a disease which affects the skin as well as the lymph nodes. HIV in the first part can have seroconversion. Seroconversion in which the patients can have symptoms like rashes, also swelling of the lymph nodes, also they can have other kind of things. No two people can have the same kind of infection in the first part. Most of the people don't get tested early. People, they have some kind of diarrheal symptoms, also vomiting, and some people also get swollen lymph nodes. More at this time, the viruses in the body fight with our immune system and they struggle to get into its body. Most of the people think this is kind of some common viral infection and don't get tested. They try to get home remedies like taking paracetamol and other antibiotics at the home and don't get tested. That's why the virus can go inside and affect the person. If you don't get tested, then after the first stage of the seroconversion, the virus remains in the body as silent or dormant thing. You cannot get symptoms till 2 to 10 years depending on the type of the virus. The virus then changes into AIDS, like it's acquired immunodeficiency syndrome, and then you can get the symptoms. So people often ask me that who should get tested. So I would say everybody should get tested, but the people who are in a relationship or who are starting a relationship or ending a relationship should always get tested. There are also some people with high risk group, like people having men having sex with men, or people who have sharing of needles. So these people should always get tested and find out a proper partner who is not HIV positive. I would suggest that testing plays a key role, and testing doesn't give you a chance to get into HIV. So please get tested. Anybody who thinks he is at risk should get tested, and what we provide at our clinic is confidentiality. Our nurse in the clinic can help you on the telephone for any questions you ask. Thank you very much.